I heard that he was going into a London hospital because he had the prostate problem. And I imagine that he had what we call prostatic hyperplasia. That means excess growth. It doesn't imply cancer. And the commonest cause is benign hyperplasia. And this causes men to get up at night for pee, have more difficulty peeing, the stream lessens. Instead of being able to hit the wall with your stream, it tends to dribble, and you get dribbling at the end of the stream as well. You can diagnose that from the history, and then you do the next thing. You ask the patient, having told them what you're going to do, of course, to lie upon the couch with their knees flexed up by their chest, and you put your finger inside a latex glove with some KY jelly into the rectum. And you can then feel the prostate in the front of the rectum, and you can feel the prostate quite easily. It's a very important examination. There was a little saying that if you don't put your finger in, you put your foot in it. And that when you put your finger in, you can feel the prostate through the wall of the rectum. And if it's round and smooth, you know it's likely to be benign. If it's craggy, then it's more likely to be cancer. And prostate cancer is an odd thing. There's a whole range of them, from what we call cancer in situ, where there's just a few cells scattered in the tissue, to when the whole organ is, in fact, has become cancerous or is being invaded more widely. But so we would imagine that King Charles III, if he was being looked after by a decent doctor, but they might have been a bit tentative, perhaps, about putting their finger into the king's rectum, but we will imagine that when he presented with his urinary difficulty, he then had a rectal examination, a per-rectal examination of his prostate. They'd also examined his penis, his testicles, and they do a general examination if they're proper doctors. They examine his tummy, and after taking a first-class history, tell me, sir, I think I would say, tell me, sir, what's troubling you? And you'd hear the whole history, and this is very important, Tony, that gives you the diagnosis in 2/3 of cases without examining the patient. So, going back to examination after good history, we might have established that the King Charles III had benign prostatic hyperplasia. That's right, and that the prostate was enlarged, and his symptoms were severe enough to progress towards a cystoscopy, examination of the bladder with a cystoscope, and whilst under anaesthetic, although you don't require that for cystoscopy, you can use local anaesthetic gel. Whilst under anaesthetic, you would examine the prostate again in the operating theatre, I believe. I did a very good urology job in Southmead Hospital in Bristol, in the best urology firm in the country, where Mitchell, one of the surgeons, had invented the resectoscope, which I'm now going to speak about. If the king's symptoms were significant enough to require removal of the enlarged prostate, then they would have inserted Mitchell's resectoscope, or a modern equivalent, with an extra powerful light made by Storz, and using a high-frequency radio signal through the little loop at the end of the resectoscope, which burns the tissue in a very local way. Then the surgeon then takes out chips with the resectoscope and gradually removes the prostate in its mass via the urethra, via the penis. You understand? And every now and again you take the scope out and you flush out the chips from the bladder, and then you go back in until you've removed as much tissue as is required. It's a skilled operation, a very skilled operation, but modern urologists will be very familiar with it. And when I go back to 1967, when I was working at Southmead with Mr. Slade and Roberts and Mitchell and Ashton Miller, he was another leader in Bristol, those men used to come in with retention of urine. They couldn't pee at all, catheterize them. Now and again, some of them were very constipated. Most of them just had benign prostatic hyperplasia. I, as a junior doctor, would put in the catheter under sterile precautions, and they go to the next operating list. They'd have an anesthetic, an epidural anesthetic by a wonderfully skilled anaesthetist there. I can remember their names now. And one of those surgeons would resect the prostate in those old chaps, and they'd be going home about 4 days later from a ward which was entirely devoted to urology of men and women. You would have expected the surgeon treating him to have examined his prostate properly per rectum, and in doing that he would have detected a rectal cancer. For rectal cancer, it's in fact a cascade really. If it could be excised, he would have an operation called an abdominoperineal resection. It's a rather radical operation. I don't get into the gory details actually, but the rectum is removed with the tissues around it, which would include the lymph nodes, and that would have been done. That is done. They may have more modern methods of dealing with it actually now, but that was the operation for rectal cancer, which you could excise with some prospect of removing the tumour and any spread into lymph nodes. When it's past that, then you might try radiotherapy, not knowing whether it's sensitive to radiotherapy or not, but you will also have to consider doing a colostomy, like Fiona had. So that's if the king has a rectal cancer, which should have been evident in any examination for prostate trouble. So that postulation of mine is weak, to be blunt about it. We don't know. There's all sorts of other cancers. I have to add too, actually, that rectal cancer can be associated with other things other than having had the COVID vaccine. There are virus infections of rectal tissue, which I think can lead to cancer as well.